Hello everybody, Dr. Tabor here again, and today we're going to talk about how decompression takes pressure off the spine and why relieving pressure may be the missing piece to your lasting back and neck pain relief. You see, less pressure equals more space for those nerves, for healing to happen, and just for you to be able to do the things that you want to do. We're going to jump right in and talk about why the problem isn't always the disc. The problem is the pressure around the nerve. All right. Now, when we look at a spine, a healthy disc is a nice, hydrated, open disc, and a disc is a gel material surrounded by ligaments holding that gel material in, and it's placed between each one of our vertebrae in our spine. What can happen when the spine shifts out of alignment or it gets damaged, or even just over time as we get wear and tear and stress in the area, the ligaments that are holding that gel material in begin to get weak and they start to bulge. And so you'll hear sometimes some people have pain, they go to get an MRI and they're diagnosed with a disc bulge. That's what that is. That gel material tried to push out against the ligaments on the outside of that disc, bulging it out. It can bulge into the nerve. Or it can even get so bad where it herniates. The ligaments that are holding the gel material in rip or tear and let that gel material out, and that herniation can then get onto a nerve and compress a nerve. This whole process is what we call degenerative disc disease. Yes, disc bulging and disc herniations are part of the degenerative disc disease process. The disc loses hydration, pressure builds and builds as it compresses, and that irritates the nerve, which then sets off an inflammation cascade and causes you pain. When the pressure builds in your spine, everything changes. You continue to lose hydration. The nerves continue to get irritated. It turns into what we call chronic conditions, chronic inflammation, and movement becomes painful. So you move less, which keeps your body from healing. We've got to have movement and health and hydration, or healing slows down. Okay? We need to reduce the pressure, restore the space in through the spine, and kick off that healing capacity that we know your body has. Here's what happens during decompression. With a gentle stretch, a gentle opening of that disc space, we decrease the pressure. So the tension inside of that area is gently relieved and the disc space begins to increase. Maybe just a tiny bit, just enough to create a vacuum inside of that disc. So that space opens up between the vertebrae, and that vacuum that it creates pulls the fluid back into the disc. And what do I mean by fluid? Nutrients, oxygen-rich fluid, blood flow begin to go through the disc, and that promotes healing. That oxygen and nutrients returning to the disc, the blood flow returning, creates a healing environment inside of the disc and helps you to overcome the damage that has been caused, that's causing your pain. That's our goal. Creating that healing environment inside of the body, inside of the disc, leads to repair, restoration, improvement in your function. See, decompression doesn't just force your body to heal, it creates an environment where healing can start to happen. Why does pressure inside of the spine make a difference? Well, we have to decompress the space in order to allow that blood flow to come back in, and those nutrients that we talked about, the oxygen that we talked about to come back in, and really to take the pressure or irritation off the nerve, because those nerves themselves can become pinched, and that can lead to more inflammation and pain. And so pain loves pressure, healing loves space. When we open those disc spaces, pull that hydration back in, we get better movement. So better mobility leads to less inflammation, which then leads to less pain, reduction in pressure, and promotion in just healing. Again, pain loves pressure, healing loves space. We've got to release that pressure so that we can restore that healing process again. Decompression creates that environment by this specific process. Step number one, when we get gentle traction on that spine and reduce the pressure on the discs and the nerves, when that space opens up between the vertebrae, that fluid, hydration, oxygen-rich blood flow comes back in, nutrients are there so that the body can then start to put building blocks together and then reconstruct the area. It results in less pain for you, better movement, improved function. Your body can then perform better the way it's designed to. You're able to get through your day. You're able to play with your kids and your grandkids. And here's the great thing. You get long-term relief, lasting relief. We call it corrective care or correction in our office because we're actually addressing the source of the problem, not just the symptoms. If you take a pain pill, how is that creating more space inside of your disc? How is that removing pressure from a nerve? How is that decompressing or getting any more blood flow into the disc area? It's not. You're just taking a pain pill. A lot of people will go in for a cortisone injection, which I don't really have anything against these things if you're just trying to get through a crisis, but you're not addressing the root cause of the problem. So the problem just sits there and gets worse and gets worse and gets worse over time while you just continue to get injections and continue to take pain pills. With our therapy in our office, decompression therapy specifically, and the other therapies that we do as well, we're focused on actually addressing the problem and improving your quality of life so you can feel better, move better, live better. So if you have anything like bulging discs, you've been told maybe they're herniated discs, or you have sciatica, shooting pain down the leg, if you've been told you have osteoarthritis or degenerative disc disease, spinal stenosis, chronic neck pain, chronic low back pain, pinched nerves anywhere, then decompression, spinal decompression specifically, could be a great solution for you to help you get back to doing the things that you want to do. So how do you know if decompression is right for you? Again, any of those things where we need to relieve the pressure off the nerve, get that disc healthy again, get that spine moving again, and get the body in a position where it can actually heal and grow and really get some long-term lasting results. So we create a personalized care plan based on your exam, your x-rays, your goals for long-term relief and better function. One more time, the right pressure, the right care equals the right results. There is a better way to heal. And I want to invite you into the office to try the decompression. You can actually come in. We'll do a free trial for you if you're already an existing patient. If not, it's only $47. We also have our Christmas and July special that is gone at the end of this week. You can literally save hundreds of dollars on your decompression plan if you take action right now. Decompression doesn't force your body to heal. It creates that environment where healing can happen. There's a power in that. The healing power that's already in your body just needs a little bit of help. The credits that we have, again, are good through this week. Maybe make sure you contact your office. We have 4 locations: Cypress, Conroe, Montgomery, and Memorial City. Ask the front desk if decompression is right for you. If you're not sure, ask the doctors. We'll do a thorough evaluation and consultation with you and make sure we get you hooked up with the right care. Thanks for listening. I'll see you on the next one.